I'm Natalie. I will be your nurse today. Do you mind sharing your first name and your date of birth for me, please?
Nevaeh Fong, April 16th, 2002.
Perfect, thank you. So today we're going to be doing an assessment on your lungs, your heart, and your peripherals, your upper extremities and your lower extremities. First, we are going to start with your heart. First we're going to start with your lungs. Just going to palpate, see if I can feel any thrills. Nope. Any pain or tenderness today?
Nope.
Okay, have you experienced any shortness of breath recently?
Nope.
Okay, can I just have you take a full deep breath in and deep breath out?
Yes.
Perfect, thank you. Okay, so next we're gonna just listen to your heart sound, your lung sounds. Okay, so every time that you feel the stethoscope on you, if you don't mind just taking a deep breath. Thank you. Okay, sounds good. I'm gonna do the same thing on your back. Sounds good. All right, next we're gonna move on to your heart. I'm just gonna palpate each valve site to feel for any murmurs, any thrills. I'm not seeing any thrills. So starting here with your aortic, your pulmonic, your Erb's point, your tricuspid down here, and then we're gonna do your mitral valve down here. Perfect. I'm not feeling an apical pulse at this time. Next, we're going to listen to your heart sounds. We're going to start with the diaphragm. Start down here. I'm going to listen to your apical pulse for a minute. Okay, with your apical pulse, I felt 70, normal rhythm. So I'm just gonna oscillate the rest now. So we're gonna go back to tricuspid. Okay, we're gonna do Erb's point. Okay, we're gonna do pulmonic and your aortic. I'm just gonna gonna flip it over, use the bell side to listen again. Thank you. Okay, sounds good. Are you experiencing any chest pain currently?
Nope.
Okay, perfect. Lastly, we are gonna do just the assessment of your peripheral, your upper extremities, and your lower extremities. Just gonna touch, feel for any discoloration. Temperature feels good. Just gonna feel for any swelling or edema. You feeling any swelling?
Nope.
Occurring in either upper or lower extremities? Perfect. I'm gonna check your capillary refill. Perfect. Less than 3 seconds. Get radial pulses. All right, that feels normal. If you don't mind just scooting back, I'm gonna do the same thing for your legs. Perfect. Just assessing again for temperature. No abnormal lesions. Skin temperature feels warm. No swelling. I'm just going to check your pulse here on your posterior tibia. Okay, and then we're going to do your dorsus pedis here. Okay, and then I'm going to just check your capillary refill on your toes. Perfect, that looks good. All right, that is all. Do you have any questions for me?
No.
Okay, sounds good. Sanitize. Okay. So patient presents for a long heart and peripheral vascular assessment of the upper and lower extremities. Patient denies shortness of breath. Patient denies chest pain. Patient denies edema or any swelling in the extremities. Their lungs, anterior, posterior, transverse 1 to 2. Breathing rate was regular. Skin color was pink, warm, and dry. Normal color for ethnicity. The breath sounds were clear bilaterally, no presence of labored breathing. Thoracic expansion was symmetric, no lumps felt. Client denies tenderness. No signs of heaves or thrusts within the heart. No thrills or pulsations felt. PMI was not felt. The apical pulse was 70 within normal limits. The rate was normal. For the peripheral, the upper extremities, the skin was intact, warm, dry, normal for ethnicity, color. No clubbing was present. Hair distribution was equal bilaterally. There was no presence of edema, and the capillary refill was less than 3 seconds. The radial pulses bilaterally were regular, 2+. For the lower extremities, the skin is intact. Skin was pink, warm, and dry. Regular color for ethnicity. There was no presence of edema. The hair distribution was also equal bilaterally on the lower extremities. There was no presence of varicose veins on the lower extremities. The capillary refill was less than 3 seconds. For the posterior tibial and the dorsalis pedis pulses, they were bilateral, 2+.